Hi guys, good morning, good afternoon, good evening. Hope you're all doing well. It's yet another week, and we're back with another episode. And on this week, let's talk about depression. And when we talk about depression, we also have to talk about mood disorders. They go hand in hand. And for this week, we'll be discussing the types of mood disorders, the diagnosis, the treatment options, and the impact on daily functioning. And I will start off by just giving a description of a few words. I'll start off with the mental health. Most of us don't really know what it means when we talk about mental health. And mental health is a person's emotional, psychological, and social well-being. It affects how we think, how we feel, how we act, how we handle stress, how we make decisions, and how we relate with each other. Mental health is just as important as the physical health. So that's a point to really note. Another word that I'll be giving a description about is mood disorders. Mood disorders are mental health conditions that primarily affect a person's emotional state. A person may experience mood swings, loss of interest in life, extreme happiness, irritability, and also prolonged sadness. These feelings are more intense and last longer than normal emotional reactions. The third one is the name depression. Depression is more than feeling sad for a few days. It is a serious mental health condition characterized by persistent sadness, hopelessness, loss of interest in activities that were once enjoyable. Symptoms typically last at least 2 weeks and interfere with daily life. And I would like to give an example, a real life example of someone who is struggling with depression. So, David, a 30-year-old lawyer, once enjoyed spending time with his friends and also working. Over several months, he became withdrawn, lost interest in his hobbies, struggles to sleep, and feels exhausted all the time. He eventually found it difficult to get out of bed and even attend work. This shows how depression can affect many areas of life. And let's go to the types of mood disorders. There are a number of them, and the first one is major depressive disorder, which is MDD. It is characterized by persistent sadness, loss of interest, fatigue, difficulty concentrating, and feelings of worthlessness. So an example is a friend stops attending classes, avoids friends, and also feels hopeless for months. The second type of mood disorder is persistent depressive disorder. I don't know if I will pronounce this name correctly, but bear with me, please. It's also called dysthymia. Dysthymia, I think. Yeah. It's a chronic form of depression lasting 2 or more years. Symptoms are usually less severe than major depression but lasts longer. An example is someone feeling down nearly every day for years but continues functioning with difficulty and struggle. The third type of mood disorder is bipolar disorder. I've discussed this earlier on, broadly, earlier on in an episode I had earlier done. So I'll just highlight something very small. So bipolar disorder, it involves alternating episodes of either moods. One, mania. And in mania, the person is usually there's excessive energy, little need for sleep, increased confidence, and risky behavior. The other one is depression, which is usually sadness, fatigue, and hopelessness. I'll give an example of the two. Jane spends large amounts of money impulsively during a manic episode and later becomes severely depressed. So, the fourth type of mood disorder is I also don't know if I am pronouncing this name correctly. Bear with me, guys. Some of these words are quite difficult to pronounce, and especially for me, who has a problem with my dental formula. Sorry, my dental formula. So the fourth one is cyclothymic disorder. I hope that's how it's usually pronounced. It's a milder but chronic form of bipolar disorder. A person experiences moods ups and downs that do not meet full criteria for mania or major depression. Then the fifth one is seasonal affective disorder, SAD or SAD. It's a depression linked to seasonal changes. Common symptoms are usually low mood, increased sleep, low energy, and social withdrawal. And now, I think this is the last one. This is the last type of mood uh, mood disorder is premenstrual dysphoric disorder, PMDD, a severe form of premenstrual syndrome, PMS, and the symptoms may include depression, anxiety, irritability, and mood swings. It usually occurs before menstruation and improves afterwards. Let's go to the causes and risk factors. Mood disorders usually result from several interacting factors, and one of them is biological factors. These biological factors can come in two forms, either genetic or brain chemistry. Genetic is usually often runs in the family. This is genetically transformed. If you had a relative, and especially close relatives, like a parent or a grandparent who was struggling with these mood disorders, you are in a very high percentage of getting the same mood disorder. And the other one is brain chemistry. By brain chemistry, we are talking about imbalances involving serotonin, dopamine, sorry, thank you. Sorry, guys. Dopamine, sorry. Well, I'm telling you, just pronouncing these names sometimes it's really, really hard, but we try. Norepinephrine can affect mood regulations. So the other cause is the psychological factors. These are low self-esteem, negative thinking patterns, poor coping skills, and trauma history. The third one is environmental factors. There are loss of a loved one, the things that happen to us now in our environment, that is loss of a loved one, divorce, financial difficulties, unemployment, abuse, and chronic stress. And the fourth one is medical factors. These are some illnesses that are usually chronic. Illnesses like cancer, diabetes, chronic pain, stroke, and thyroid disorders, the increased risk of depression and mood disorder. Then the last one is substance use. Substance use, the use of alcohol or drug misuse, It can worsen or trigger mood disorders. We go to the signs and symptoms of mood disorders. The first one is emotional symptoms. These are usually sadness, hopelessness, guilt, emotional numbness, and irritability. There is another one which is cognitive symptoms. These are poor concentration, memory problems, indecisiveness, and negative thinking. Then there is the physical symptoms. They include fatigue, appetite changes, sleep disturbances, body aches, and headaches. The fourth one is behavioral symptoms. They are social withdrawal, reduced productivity, reduced self-care, and neglecting responsibilities. And lastly, on this part, let's talk about warning signs of suicide. This may include someone talking about death a lot of time or most of the time, feeling trapped, giving away possessions, saying goodbye, and increased hopelessness. It is very important to take all suicidal statements seriously. For the signs and symptoms, there are things that you can look out for from someone. When you see any of the things that I've talked about and they are very consistent, it's very important to seek help for them, or even encourage them to just seek help and know what is really going on with them, because they might not be aware that they are struggling. So the other part I'll be looking at is the diagnosis of depression and mood disorders. Maybe someone might be asking themselves, how are the mood disorders diagnosed? So, diagnosis is usually carried out by a qualified mental health professional, such as the psychiatrists, psychologists, or even clinical officers trained in mental health. The second bit on diagnosis is usually the assessment methods. These are usually clinical interviews. These are questions about someone's mood, their sleep, their appetite, their energy, and even their life circumstances. Then the other part in the assessment method is usually the psychological assessment. I'll give just two examples, and I will not really give more details on the two. They are usually the PHQ-9 and Beck Depression Inventory. Those are the most two examples that are usually done for psychological assessment of depression. And then there is the medical evaluation. These are doctors may rule out physical causes such as thyroid disorders, vitamin deficiency, and also neurological conditions. And the last one is usually the diagnostic criteria. The symptoms must persist for a specific period. They also cause significant distress, and lastly, they interfere with the functioning of the person. Let's talk of the treatment options. The treatment options of someone who has the mood disorder or even depression. The first option is psychotherapy, and in psychotherapy there are a number of therapies can be carried out to help the person. One of them is cognitive behavioral therapy. We usually refer to it as CBT. It helps identify and change negative thinking patterns. For example, if someone keeps thinking that I always fail, when you use this therapy, they are able to reframe their thoughts, and they can accept that, yeah, sometimes I feel at some things, but I have also succeeded at others. The second one is interpersonal therapy, IPT. It focuses on relationships and communication. And the third one is family therapy. This helps families understand and know how best to support the affected person. And the fourth one is group therapy. The group therapy provides peer support and also shared learning. So the second treatment option is medication. Some common antidepressants include SSRIs and SNRIs, but it is very important to note that medication should only be prescribed. They should only be prescribed and monitored by a qualified healthcare providers. So over-the-counter medication is not allowed, and especially for people who are dealing with mood disorders and depression. So the third treatment option is lifestyle intervention. These are the common things that we do for ourselves every day. One of them is exercise. Regular physical activity improves mood. The second one under lifestyle intervention is health diet. Eating a balanced nutrition supports brain health. The third one is sleep hygiene. Ensuring you maintain regular sleep schedule helps emotional regulation. The fourth one is stress management. This method may include relaxation exercise, mindfulness, and time management. And under the treatment options, there is the hospitalization. This may be important when you realize that someone is at high risk of suicide, severe psychosis is present, and even safety is compromised. That is when you seek hospitalization. So, the other thing we'll be discussing is how mood disorder impact daily functioning. There are so many things that we do every day, and they can be affected if someone has a mood disorder. So one of the impact is on work and school. Someone experiences reduced concentration, there is poor performance, there is reduced motivation, and sometimes they might not even see the importance of attending the work or even the school. So there is absenteeism. An example is a high-performing employee begins missing deadlines and struggling to complete routine tasks. The other part we'll be looking at is impact on relationships. They withdraw from loved ones, there is increased conflict, and sometimes communication becomes very difficult. The impact on physical health is that depression may contribute to poor sleep, chronic pain, reduced immunity, and poor self-care. There is the impact on family members. The families with people who are struggling with mood disorders may experience stress. The caregivers may have so much burdens. There is financial strains and there is the emotional exhaustion. The impact on quality of life. Most individuals experience reduced enjoyment, loss of purpose, and reduced participation in meaningful activities. There are a number of myths and facts on depression, and we're also going to look at that. So, most people think that depression is a weakness, but the fact is depression is a medical condition. The other one is that people think that people can just snap out of it, but the fact is recovery often requires treatment and support. The third one is that people think that depression only affects adults, but the fact is children and adolescents can also experience depression. The fourth myth is that medication is always required, but the fact is treatment varies by individual. And the last one is that talking about suicide causes suicide, but the fact is asking about suicide can help people get support. How can you be able to support someone who has depression? One, helpful actions that you can take, or you can exercise is listening without judgment. You can also encourage professional help. You can offer practical support. You can stay connected with the person, and you can also learn about the condition so that you can know how best to handle the person. The second one is by avoiding saying some of these things. Most of the time people just tell you, just be positive. Others will even say, others have it worse. Or the last one is, you need to try. Avoid saying some of these things. You have to be very sensitive when you're handling someone who is struggling with depression or any mood disorder. Better responses are like, I'm here for you. How can I support you? Would you like help finding professional support? Those are some of the things that you can use. And I'll give a few. As I finish off, I'll leave you with a few key takeaway points, which is depression is a common and treatable mental health condition. Mood disorders affect emotions, thoughts, behavior, and physical health. Also remember that early recognition improves outcome. Effective treatments include therapy, medication, and lifestyle changes. Family and community support play a critical role in recovery. And lastly, seeking help is a sign of strength, not weakness. So I would really encourage someone, if you are struggling with depression, if you're struggling with any mood disorder, seek help. Seek help and you will get the help that you need. Also, thank you for watching this. Share with someone you think might benefit from it, and see you on the next one. Thank you.